Okay, then I think that takes us to 5 minutes, so let's get started. So thank you very much to everyone for joining this webinar today. We are looking forward to sharing with you the recommendations following the recent strategic review of the Rare Disease Day Awareness Campaign, and looking a little bit further at the next steps for the Rare Disease Day 2020 campaign. And I'm very pleased today to be joined by Sophie McHugh from H&K Strategies, the agency which carried out the recent strategic review. And I know many of you have participated through surveys and calls and interviews, so you'll be familiar with this strategic review, and we're very pleased to have Sophie with us today to go into detail about the recommendations. And I also have Simona Belligambi from UNIAMO and EURORDIS Board of Directors as well to speak with us about co-creation. Great, I just see we have some raised hands. What I will say is if you do have any questions during the presentations today, we will have time for questions at the end. So if you please feel free to type into the question and answer box, and we'll be sure to answer your questions during the presentations, and we'll have a dedicated session at the end as well. I will also introduce myself, Lucy Michaeludis, the Junior Communications Manager at EURORDIS, for those of you who I haven't yet had a chance to meet in person, and I'm hoping I will be able to meet many of you at the upcoming face-to-face meeting at the EURORDIS membership meeting in Bucharest. But for now, let's get on with the webinar, and I will hand over to Sophie.
Thank you, Lucy, and thank you for having me during the call. For those who I haven't previously met, I think I've met most of you. Like Lucy mentioned, my name is Sophie McHugh, and I work at Hill & Knowlton Strategies in London, and we have collaborated with EURORDIS in providing a series of recommendations for the future of Rare Disease Day. So if we just jump to slide 3, I can give you an overview of what we did and where we've landed. So if we just go, okay, perfect. So I hope everyone can see the screen right now. This slide just provides a very quick overview of what Project LEAP, that's what the strategic review is called. So initially, our initial challenge was that we wanted to examine the perception and value of Rare Disease Day and determine what EURORDIS's role should be in supporting its constituents to help them deliver greater impact on the day. And to do this, we, over the course of, I think it was about 5 months, we conducted quite extensive research here in London, and also collaborated with our counterparts in the Brussels office. It consisted of in-depth qualitative and quantitative research using a variety of methods, such as interviews, workshops, surveys. I think I spoke to quite a few members of the national alliances, and in particular did some one-to-one interviews as well. So altogether, we spoke to over 70 respondents from 22 countries. And the way that we broke our analysis down was we identified 5 key thematic areas of prominence. So all of our recommendations fall under one of these 5 buckets. So the first one was awareness and impact of Rare Disease Day. So the cause of Rare Disease Day is currently diluted. This is what we found with our research. There's an abundant rather than focused messaging, and there is misalignment on the audiences for Rare Disease Day. Compared to other audiences, the patient community is not as engaged when participating on the day. One of our second key findings was based on the value of Rare Disease Day branding and materials. So currently we saw that the campaign materials and tools are appreciated, particularly those that are visual, so for example the video. However, there is a lack of universality that drives inconstant adoption and uptake. We heard this a lot actually on the initial, one of the first calls that we had with the national alliances, and that drove quite an extensive conversation there. And this was also supported by the construct of the theme and the slogans that made sense initially, but now needs a revamp. Our third bucket of finding was operations of Rare Disease Day. So in order to grow and to make content visible, there needs to be an upgrade on the campaign strategy. So these are things that include an update on the content that we're delivering on our website, as well as on social media, the campaign objectives, and also looking at if we have key messages, what should they be? And they should align across each country as well. For the national alliances and member organisations, the rare disease campaign is late to launch and has an unclear stakeholder prioritisation. So we did hear from a few national alliances that they were receiving materials quite late in the game. They'd prefer to be included earlier on, and so that is something that we have put into our recommendations. The fourth bucket was very much based on policy and the impact of policy. We found that the conversation within the policy sphere is hidden and somewhat disconnected from the day. Rare Disease Day is very European focused. While the ambition is to be global, this has resulted in countries outside of the EU feeling excluded from the conversation. And our last thematic finding was on fundraising and industry collaboration. So we found that for the member organisations, national alliances and EURORDIS, fundraising has different meanings and serves different purposes for each group. Industry and partners will collaborate if the goals and objectives are shared as well. So we did speak to a few people, external counterparts within the pharma companies, who did say that they would are very keen to participate and collaborate if that opportunity presented itself. So that's a very quick overview of where our findings landed. If we go to the next slide, this is an overview of our key recommendations. And I'll go through all of them. I won't spend too much time going into depth on them because we are focusing on one specific recommendation today. So from those key buckets that I've just gone through, our recommendations were, firstly, make EURORDIS the global steward of Rare Disease Day. So we need to be clear about who the priority stakeholder groups are in the EURORDIS ecosystem and create focus there. We want EURORDIS to lead and not to actually just own the day. The next recommendation was the integration of policy and communications on the day. So create new and co-owned thought leadership content in partnership with think tanks, policy thought leaders and academics. And this can help national alliances have a fresh policy conversation at both a national and a local level. Then we move on to democratization of the message. So create campaign messaging, which is the narrative of the Rare Disease Day story, and a content and publishing strategy that is aligned to audience, behavioral insights, and Rare Disease Day cause. Clarity on audience and objectives of Rare Disease Day. So we suggested that there needs to be we need to be clear about who the priority stakeholder groups are in the EURORDIS ecosystem. So that this includes EURORDIS, the national alliances, member organisations, local member organisations as well. And then we need to create focus as well in which stakeholders own what. Moving on down to the second line on the left in the yellow, we recommended that to engage and involve the national alliances earlier in campaign strategy and planning. I mentioned this before, but we recommend piloting Rare Disease Day calls during the mid-planning process to onboard the views of other markets, particularly from those outside of the EU. So that's one of the main reasons we're having this call today as well, is to talk about the cause and what that is. Next is capacity building on fundraising, so upskill members to leverage Rare Disease Day as a way of driving local fundraising and make fundraising an integral aim of Rare Disease Day. We also suggest keep it simple and keep it visual, so this has a lot to do with some of the materials that are developed for Rare Disease Day. We've made a few suggestions here. So firstly, hero the Rare Disease Day logo, abandon the campaign slogan. have one clear campaign hashtag and simplify the theme and represent it visually so it does resonate across different countries and different languages as well. Next on the list was harness youth and young physicians mobilisation. So we found that engaging young patients and physicians to encourage participation in Rare Disease Day can spearhead efforts to influence the policy agenda on a local and global level. This was done through some further research into what's happening at the moment, especially in climate change, and how the youth voice right now is completely strong, and there's a lot going on. So I think, I'm not sure whether you have seen the full report, but each recommendation goes into a lot more detail. This is just very top line. And then on the bottom row there, so the first on the left in the pink box, decide on a cause and a call to action, in brackets visual, because it's very important. We wanted EURORDIS to co-create a Rare Disease Day cause which national alliances and member organisations as well as stakeholders can share. So that is the purpose of the call today, and we'll go into that one in a bit more detail. And then the last few recommendations, so update campaign materials and tools. So the campaign video focusing more on visual and stripping out that language to make it resonate more so in other non-English speaking countries. We find that less is more, so relevancy of tools should be considered over the volume of materials and tools that EURORDIS are creating. And then also to try and create editable campaign materials for more flexibility. So trying to make materials that other countries can adapt easily. Next is engagement of other stakeholders and partners. So looking at hospitals and universities as well. This is something that we didn't think was done strong enough, and we thought that there was an opportunity to work closer with industry to make Rare Disease Day a bigger collective event across wider stakeholder groups and deeper activations. And then our last recommendation on this page was to update the operations of Rare Disease Day. So create a formal best practice exchange, share ideas, apply learnings to improve outcomes and save money. So implement, and to also implement a content and publishing strategy. So like I said, this is very top line of overview of our recommendations, and I think if you were to look at the full report, which I'm sure has been shared or will be shared with you, you can look at the research that kind of backs those findings and recommendations as well. But like I mentioned, we are focusing on one of our recommendations today, and that is to look at what the purpose of Rare Disease Day is and what is the cause of it. So if we move on to the next slide, I just wanted to explain a little bit as to why we need a cause for Rare Disease Day and what the term cause actually means. So from our research, we found that member organisations find it difficult to get people involved at a local level, that there is a lack of understanding as to what the cause of Rare Disease Day is, and it could be because it is currently diluted and abundant rather than focused messaging. So what we propose is that EURORDIS take a look with support of the National Alliances as a co-creation exercise and look at what the key messaging is of Rare Disease Day. So because we found that research out, we then knew that Rare Disease Day lacks a clear purpose. The value of increasing awareness amongst the general public should be weighed against other stakeholder groups. And the full potential of engaging with the rare disease community has not yet been fully realised. I'm sorry, is there a ringing in the speaker? Can everyone hear me okay?
Yeah, I can hear you fine.
Okay.
I think.
Okay, good. So then from this, so we saw our research. From that, we made an analysis of what that means. And then so we've recommended to move forward, we need to actually go back. So we need to co-create a Rare Disease Day cause which national alliances, member organisations and stakeholders can own. Sorry, Lucy, I think it just skipped the previous slide. Okay, I'm just seeing everyone's
is this right?
comments coming through. Yep, that's Oh, the previous one. Yeah, that's right.
Sorry, there we go.
Yeah. So what we suggest is that we create a campaign messaging narrative, if you prefer that word, and a content and publishing strategy that aligns to that. And we're using behavioural science and the Rare Disease Day purpose as well. So really, we've suggested that we go back to basics and work out what is the purpose of Rare Disease Day. We need to have, and we need to all agree on a strong key purpose for the day, and then also work out what the cause is. So there is quite a big difference between what a purpose of campaign is as opposed to a cause. So if we move on to the next slide, I've provided some definitions below. So the purpose is the reason you exist and the legacy that you will create in the world. So this includes the emotional, it's the rational, and it's what you need for you to matter. And I'll provide some examples of this in a second. Whereas the cause is the thread that links all of your communications. So it's the bridge or the lens that leads to your story arcs, and it makes you relevant today. So the cause should be actionable. It's not a tagline, but it should create a movement and create a community as well. So to get our heads around what these two definitions actually mean, I've provided some examples. So if we go to the next slide, these are a few examples of a purpose from some well-known brands and organizations out there. So if we look at what Nike's purpose is, it's to bring inspiration and innovation to every athlete in the world. They believe that everybody is an athlete. Amazon's purpose is to build a place where people can come to find and discover anything they might want. And IKEA's is to create a better everyday life for the many people, whereas Airbnb is to help people belong anywhere. So I hope that those definitions, if you're familiar with those organizations, they should make quite a lot of sense to you. For example, Airbnb, they provide people with homes across the world when they're traveling, and it is a great their purpose really does resonate with what their brand provides to their customers. If you go to the next slide, to give you a good example of a cause. So this is a campaign that was developed by NHS England. It was developed 10 years ago, and it would have to be one of the most successful intervention campaigns that we've seen in the UK. So their cause is Change for Life. So as I've mentioned, the cause is an overarching idea that ties the campaign together, and which can be applied to multiple issues, audiences and channels. So it should be inspiring, ambitious, and it does command action. So NHS England came up with this. It was launched as Change Your Life campaign, and it was England's first healthy lifestyle brand, which famously invited families to eat well, move more, and live longer. So that was their cause. So we would assume from looking at this that their purpose was to improve the health of the nation, and then that was their cause. So you can see how they are quite different there. So those, I also, if anyone's interested, I have a really good article that talks a lot about this this exact example here of Change for Life, in terms of how NHS developed this campaign over a series of 10 years and how it's adapted to lots of evolving factors as well. So it does, the article does bring to life how that cause has worked for so long. So that's it for me in terms of explaining the purpose and the cause and providing a very brief overview of our recommendations. Like I mentioned, please do feel free to look through the full report as well, and we're always available to answer any questions on that. But I hope you do find it useful. I've seen some comments saying that sound may not have been great. So if anyone does have any questions, please do let me know.
Great, thank you very much, Sophie, for that brilliant introduction to our recommendations. Okay. Great, thank you very much. I will then take over and we will go into the next section, which is finding a cause for Rare Disease Day. So this takes us into the nitty-gritty of what we'll be working on over the next few months, together with national alliances, with our member organisations, with all the organisations involved in Rare Disease Day. So a theme versus a cause. So what I would like to start off with is by thinking about why we would choose to adopt a cause and move away from the theme and slogan that have had in previous campaigns. Now, as we know from the outcomes of the strategic review, the campaigns in the past have had many different messages, and it has been particularly word heavy in terms of having a slogan and then a theme and then different messages coming through the social media campaign, through the poster. So what a cause can really do is to provide us with one core message and a core concept, and the real clarity, which means that we can build a campaign that has even more impact, bringing us together around one cause. And the idea, of course, is that with it being a broad idea, is that we can then have it adapted to local and national priorities. Because as you can see with the list of the previous themes we've had, they have and sometimes been particularly focused on specific areas, so such as research or social care. And what the cause to do is be broad enough in that it allows at a national level and at a local level to really hone in on your priorities, but whilst bringing us all together under one cause. So whilst it's broad, it needs to still be meaningful across diseases and borders. So this is why we are really looking forward to spending this time over the next few weeks to really make sure that the process we have to find the cause is something that can work in different contexts, you know, outside of Europe, in different countries and different contexts, and in all of your work for Rare Disease Day. The course, as well, as we've seen it being described as a creative platform. So it's that one message and feeling that's going to come through the social media campaign, through materials and visuals that are produced. So it's very much a way of streamlining and having a clear centralized messaging to avoid the diluting of campaign messages, which may have been the case in the past. And another point to highlight here is that whilst in the past we have had a different theme and chosen a different slogan every year, the idea of having a cause is that it's a constant, it's what we're still working towards. So it doesn't necessarily change every year. It's something that's still going to be relevant over time. It can evolve with the environment as as there are technological developments within the rare disease environment. Maybe we might have to adapt, but the idea is that, of course, the campaign and the visuals will have an annual change, but that the cause at the core stays the same. So I hope that is clear about why we are moving towards one centralized cause, and from the theme and slogan that we've had in the past. So with that said, I would like to share with you some ideas that we have had so far. So these have come about through some discussions we've had within the EURORDIS team, and they very much act as a starting point. This is very much the beginning of our journey to finding a cause. So we are very much looking forward to having your input on these. And I must say they also have been developed through looking at common challenges which are common across diseases and across borders. So breaking isolation is one of them. So this is the idea of making sure that people living with a rare disease do not feel isolated and alone, even if they're the only person in their country, in their town, living with that particular disease, that they have access to the support and the services that they need. Inclusion is an idea that came up, and it works on many different levels. So we can think about including people living with a rare disease in larger society so they can take part, go to school and work, including them within a mainstream health care system, including them within research calls. That one really does work on different levels. We have Speaking Up, so Rare Disease Day acting really as a platform to bringing the patient voice to the forefront, and making sure that we really are a channel for that voice to come through on Rare Disease Day. Then we have visibility, and this one comes through from an idea which I'm sure many of you will already be aware of, the idea that rare is not so rare, that rare is in fact 300 million people worldwide, and that what we need to be doing is shining a light on this community, which, although spread out across the world, really does have strength in numbers. Equality. This is an idea that came up in terms of equality, so equal access to healthcare, being an equal member of society and being treated equally. Again, one that works on many different levels. Education. Education in this way means educating the public and about the idea that rare disease as a concept exists, and even educating the rare disease community themselves, because we have realized through the strategic review recommendations is that there are people living with a rare disease around the world who don't yet identify or feel part of the wider, larger rare disease community. So this is really about educating, so what is a rare disease, what are the common challenges, and how can we work together on that. Then we have community. Again, there are some similarities and overlaps with these, but community really, the idea that we're stronger together, that even though there may be a few people living with one disease, really together we are stronger. And finally, collaboration. Again, so the idea of working together to overcome these common challenges, working across borders, kind of links with ERNs, all kinds of different cross sections there. So these are some ideas that form a very preliminary shortlist, and we do look forward to having your input on these, and also very much to have an opportunity to contribute any new ideas that you may feel are missing. And so how are we going to do that? So this webinar, of course, is a first chance to exchange on these cause ideas that we have. But we also will be launching a very short survey to gather your thoughts on the possible cause for Rare Disease Day. So it will include being able to express your preference for the ideas we already have, and also being able to propose any new ones that you feel are missing. So this will be disseminated widely to our national alliances, to EURORDIS members, to any organisation that has participated in Rare Disease Day through the Rare Disease Day website. And this will be coming very shortly in the next few weeks, and will continue through June. So it will be running for a short period so that we can come to a decision fairly swiftly. And so this will be disseminated via the member news and directly by email. And of course, if you want to disseminate it within to staff members within your team as well, that's fine. So that is to come. So just moving on to a timeline, so we can think about how we do actually get to a cause for Rare Disease Day. So following today's webinar, we have the face-to-face meeting with the Council of National Alliances this Thursday, and that will again be another opportunity for discussion and feedback on this. And then, as I mentioned, we have the survey running from the end of May to the beginning of June. And in June, once we have the feedback from the survey and we have a kind of clear shortlist in mind, we can then go forward and have a vote on which cause we should go forward with for Rare Disease Day. And then once that key piece of work is concluded, we will be working with the working group on developing a call to action and a creative concept, and really going forward with the campaign for Rare Disease Day 2020. As you can see, we would like to move on from the creative concept and moving to actually developing the materials through the autumn, so from September to October, and working to share with you these materials as soon as possible. As we know, this is something that definitely needs to be improved, so we hope to be able to disseminate these materials before the end of the year, through November and December. So that's an idea of the upcoming timeline over the next few months. And I will now move on to just give an outline of EURORDIS's role in the Rare Disease Day Awareness campaign as it's come through the strategic review, before handing over to Simona. So EURORDIS, within the communications team, we are coordinating the Rare Disease Day Awareness campaign. So with the co-creation and the call to action, we are very much working with all of you, with our participants in Rare Disease Day, our country organisers, national alliances, membership organisations, and we also work more specifically with the working group, especially in the months coming, to defining creative concepts and a call to action. So that will be starting very soon. Again, EURORDIS's role as a global relayer of the campaign. So as we are organising the international campaign, we have a unique perspective of being able to see what is happening all around the world. And within our website, many of you will be familiar with the event upload section, and we really do have a wealth of information there. And we therefore see our role as sharing stories from different countries around the world, different places, to show the impact that the Rare Disease Day campaign can have at so many different levels. So that will be our role, is to working with you directly to collect this information, to know about what's happening in your local communities, and then to be sharing those stories wider to really give a broader perspective on what Rare Disease Day means and what it can involve in different contexts. And then creating and disseminating materials, so working to produce the posters, any video content, other visuals, and things which are available to download and to be used on the Rare Disease Day website. So I will now pass over to Simona, and then we should have some time for questions. Thank you.
Thank you. Thank you, Lucy. So I think almost everyone knows me, and you know that I'm EURORDIS board member, but I'm also, and mainly I would say at the beginning at least, the referent for the Italian National Alliance. And I was there when it all started. I'm quite experienced now. And I know that we walked a very long way to have a very successful Rare Disease Day, because the Rare Disease Day is very much needed. But it is true that we achieved a lot of goals, and our needs and our experience have evolved a lot. So indeed, nowadays it is more than needed. The role of national alliances, member organizations in the co-creation of the cause and the call to action, because at the beginning it was just a matter of being visible. We were so happy, we were so excited. But then I think, and this is my personal feeling, that along the years we might have lost this global excitement versus a local need. So I think it is very much important that all the voices are heard while we are co-creating the cause. And I think that the move from a theme to a cause already addressed one of our needs, because the theme was very often too specific, didn't address our specific needs. It was very difficult to be adapted at local level. So it is important, the role of every single member, national alliances, member organization, in the co-creation of the cause in order to be even more successful. It's obvious then that our role is then to adapt this cause and the call to action and to disseminate the materials at local level. But this is what we have been doing over the years. It's obvious that if we believe, if we have a feeling of being owner of this cause, we will adapt and disseminate the material even better. And this is why at national level, we are the national relayers of the campaign, sharing the information and the stories. And this is very much important. And some of us are very good in doing it. For others, we can share experience and learn from others that are very good in doing it. We can move to the next one. And so it is very important, as I just said, that we receive your input. And I know it's an important commitment, because we already started working in a working group on that. But then there are barrier languages, there is time commitment, and we are all very much busy, but we need the input of everyone on the cause, on the campaign messages, if we want to be successful and efficient. And then to create the concept. And it's important, because the creative concept as one of the main goals of a successful campaign. And we have to work together. So as we already asked to last year and the previous years, we needed to have a referent within the national alliances to be able to work all along the timeline that Lucy just showed you, because otherwise we will risk to lose pieces and information, and we might not be as successful as we could. So I know it's a huge commitment. We have all national alliances have issues with human and time resources, but if we do believe it, that we need a successful, and we do, a successful Rare Disease Day campaign, we have to find the time, the right person to co-create the campaign and the cause and the call to action. And then we will be all so happy, and we will see how this is efficient and the result of it. I think that's enough for me.
Great, thank you very much to Simona and to Sophie, the two panelists. I would just like to finish off by saying thank you very much, and we do now have some time for questions, but if there's anything that you'd like to discuss further or would like to speak to us about, please do feel free to get in touch via my email address, lucy.michaeludis@eurodis.org. Excellent, thank you very much. I will now stop sharing so we can take a look at the questions. I'll see, okay, I see we have a question in the chat box. I'll just take a look in the Q&A. Okay, I think that, yeah. Okay, so a question from Eva to us. What is the purpose of Rare Disease Days? And getting back to the distinction that Sophie made with the cause. Do any of our panelists have anything to add on this topic?
Yeah, I can add to this. I think that is obviously a question for EURORDIS in terms of identifying what the purpose is. That can be obviously co-created with the national alliances, but I think it definitely needs to be originally designed by EURORDIS because it is. I've just got a comment saying you can't hear me.
Yeah, I can hear you. I can hear you. I'm not sure.
Maybe you can just relay what I say. In terms of that, the purpose is overarching. So if you think back to the NHS example that I shared, we can assume that their purpose was to improve health of the nation. So you can see that that's quite broad, whereas the cause was more simplified and direct, and it was more ambitious and inspiring. So we do need to first set the purpose of Rare Disease Day, then work out what that cause is. So you may have done that back work already, I'm not sure, but it is a good place to start in terms of constructing that.
Great, excellent. Thank you very much, Sophie. And this is definitely something that that we can speak further about during upcoming face-to-face meetings as well. There was another question about sharing the presentation and sending it by email. Yes, so this is being recorded and the slides can be shared as well. So that's no problem if you'd like to share those with your colleagues. Okay, interesting question from Leslie. So it's about the purpose of Rare Disease Day originally, and so what has changed from then to now. So, I mean, I'm just speaking as a fairly new member of staff working on the Rare Disease campaign. But for me, we have the Rare Disease Day campaign as an awareness raising campaign. Really, it's a moment in the year to unite around making sure that the rare disease cause and the rare disease community is understood, is visible, and is seen. And there's definitely further conversations to have as we go to defining the cause, therefore, as that's more specific about how we want to be achieving impact through the campaign. But I think at its very core, it still rests, it still remains about raising awareness amongst a very wide audience. Okay. I'm just having a look back through some of the comments. About proposing another initiative referring to community. Okay, so if you would like to make any suggestions, please do so by email or by the survey, which will have an open box for ideas to be submitted. We have another comment. We have the language barrier with the video, and it makes it less attractive to us. Yes, so that very goes back to the recommendations that Sophie shared with us earlier about the many messages coming through with lots of texts and having a theme and a slogan, and in recent and having lots of speech and voiceover through the videos. So we are really very much taking on board the idea of simplifying and keeping things visual, and really trying to transmit that core message just through visual storytelling rather than necessarily through speech, which then involves subtitles, and then which can then make it more difficult to share and disseminate at local level. So that's definitely something that we're aware of. Okay, we have a question about, it says, Sophie, maybe could you explain again what you found about trying to focus on reaching the grassroots? Yeah, does that make sense?
Yeah. Just a quick question for you, Lucy. Is the final report going to be shared?
Yes, yep. The final report has already it's been sent to the national alliances, and we can make it available for anyone else who would like to read through.
Okay, great. Because I won't labour on this point too much, just to give you an overview. So within the report, we do talk about the grassroots level of Rare Disease Day. So one of the things that we found is that Rare Disease Day is valued by all, but there does need to be a sharper focus at a grass tops level on identifying a strong cause for Rare Disease Day, which can then be pulled through into a meaningful call to action to meet the grassroots level. So those are the patients living with rare diseases. So the idea of reaching the patient community really does come to the next step, which is your call to action. So I think one of our key findings from the report was that compared to other audiences, the patient community wasn't as engaged when participating in Rare Disease Day. So we do need to understand why our patients aren't engaging on the day. And we need to then identify, is it because we don't have a clear, strong call to action for patients? Do they know what to do on the day? Do they know how to participate? Do they even know that the day is a day? So we have put a lot of information into the final report on that. And one of our recommendations to kind of rectify that key finding was working with, we have a behavioural science team here at H&K, and they can really tell us how to speak to not only the general public, but also specific key audiences about speaking to them with simplified and really strategic messages. So I think if you look at, I think it was the bucket awareness and impact in the report, it will provide a lot more detailed information on that as well.
Great, thank you very much for that, Sophie. Just reading, going through, reading some other comments. So from FEDER in Spain, they say they want the project the associative movement as the transformation axis, and we are valuing the next Rare Disease Day. That's great. I'm glad to hear that. And the associative movement will be the subject. So again, I think I take that to mean that we are very much trying to build a very strong community around the next Rare Disease Day and going forward. And then, hello, hi, Ulrika, who's joined us. Then we have another comment saying we can ask the national TV channel to play the Rare Disease Day video only if it's ready at the end of November. So timing is very important. Yes, that has definitely come through with the feedback through the strategic review. We are very keenly aware that the sooner we can get the video content and posters and things out to you, it really allows you to launch your campaigns at a local level. So that's useful for us to know about those deadlines. And then we have some feedback on the visibility idea, 300 million rare people. Yeah, that's huge. Exactly. So when we're talking about you know, the number of people living with a particular rare disease, it's often a very small number, and they're sporadically spread across the world. But what we want to show is that what we really are is a very strong community. The possibility of voiceover in national languages would be good. The video would be okay for national TV if the voiceover were in the national language. Okay, again, so a few comments on the video. Great, I'll see if we have, I think we might have a question in the Q&A box. Okay, that's great, that's come through already. I will just see if any more questions come through. But in any case, I would like to take the opportunity again to say a big thank you to Sophie and to Simona for joining us today, and to really encourage anyone who's taken part today to get in touch with us if you do have any further questions. And we will be sharing a recording and the slides, and the very next step to keep an eye out for is therefore the survey, which will be coming your way very soon, followed by working with the working group in the next coming months as well. I'm just scrolling through to see if we have any final questions. We don't. Okay, so all that leaves to say for now is thank you very much, and I look forward to seeing some of you who have joined today at the membership meeting later this week.
Thank you very much.
Yes, thanks everyone.
Bye.
Thank you everyone.
Thank
Bye-bye.
you. Bye.